This is a good one.
Yeah,
This
yeah.
is like
Anthony
a
Richardson.
controversial thing.
Yeah, Anthony Richardson. I wanted to get to that because we've been yip yapping away, and as time is ticking over here, let's get to Anthony Richardson's with his AC joint sprain. And once again, we hear sprain, or I hear sprain. I go, well, that doesn't sound like it's too concerning. But grade 3, what's your biggest concern with this? Also, once again, it's the throwing arm.
Yes, so this is controversial topic. Good, you picked a good job. You always do a good job with this, Will. So AC joint injury, acromia clavicular. So acromion is this, it's a shoulder separation, right? You've heard the word shoulder separation.
Yep.
It's really common in bikers, football, direct blow onto the shoulder. The thing about this is for every grade, there's 6 grades, but we almost never see the 4s and the 6s. Those are like with some weird, the clav was stuck underneath. It's just almost, I think I've seen one in my whole life. But the 3s and the 5s are the ones you worry about because those are the ones that might need surgery. 1, 2 is like a little bit. 3 is where it comes up a little bit more, and then 5 is where it's like way up. If he had a 5, he would have automatically gotten surgery. Okay. Yeah. But because he's a 3, the 3 is where it's on the fence. And so the data shows that if you have a 3, that half those patients don't need any surgery. They'll get back on their own. And I have one of the Mershon football players I just did this with, and I was able to treat him without surgery. But some people come back, and I've had this at like 2 months, 3 months, 4 months, and they still feel bad. They can't throw. They have like popping, and it's unstable. And what they've seen now is it's actually maybe more like a 3A and a 3B. The A's can get back, and the B's don't because there's actually a component that's we think about AC joint injuries, the chromium goes up, right? That's how we measure it, but we don't think about it. Remember, our body doesn't work in one plane; it works in 2 planes. So the concern is that some of these grade 3s actually have this stability and this, and when you have both, then you might not get back. My assumption is he just had this one, right? Or they would have probably done surgery on him. But we've done studies on this looking at baseball players. It's a really common baseball injury. And you ask about the team doctors, and it was crazy because only half of them said they would ever do surgery on this. The other half said never would do surgery on a grade 3. I will do surgery on somebody, but again, the studies show that you want to try no surgery first. So the surgery timeline, the recovery timeline for this is about 1 to 2 weeks for every grade. It's like an MCL.
Without surgery.
Without surgery, so 6 weeks.
So you should have the needed information for you to think about your next step within the 2-week period.
Usually I tell them 6 to 8 weeks, Now with him, he's going to be monitored more closely. But I told the football player in the office who's going back to play, I said, go back and play for the season if you can. And if it starts feeling unstable, you can't do it. We got to pull you out. We're going to do surgery on you. And if you can tolerate it and it's bad at the end of the season, then we do it at the end.